The payment of antiretroviral therapy by National Health Services has led to do some pharmacoeconomical analysis and other strategies. In Spain, there's a universal access to these drugs, and they are delivered by law in pharmacy departments. It's not strange to see that patients give us back opened packages due to changes made by doctors. Perhaps could be by interactions, different situation of the patients like pregnancy or side effects, and so on. In order to know the uses of medication, our team defined the concept of social efficiency of packaging. The best social efficiency packaging is the best adapted to unidose dispensation. We define a classification of the so-called social efficiency of the antiretroviral drug packages that could be applicable as well to any other family of high-cost drugs used for outpatients or inpatients, like for example hepatitis C direct antivirals. The classification was made in 4 classes: A, B, C, and D. Class A is a drug packet in unidoses with complete information, name of drug, dosage in milligrams, lot number, and expiring date in each unit, therefore maintaining complete information if returned when the external package is opened. No unit dose are opened in returned packages. Class B, drug packed in blisters with complete information only in the blister, but not in every unit dose, without special conservation conditions. Should be initially repacked in unit dose in the pharmacy for its dispensation to assure a Class A excellence. Class C, drug packed in plastic containers with complete information written only on a label over the container, with no special conditions of conservation. It will be allowed repacking only before its initial delivery. And finally, Class D, drug packed in plastic containers with any manufacturer's warning that the product cannot be placed outside of the original package due to a special condition of conservation, fridge, humidity. So these conditions will not allow either an initial unit dose repackaging or reusing an opened container. Class B and C packing increase pharmacy department budgets in human resources, time, and repacking materials. In Class D ones, all the contents will be lost once the container is opened, regardless of being returned. We studied the amount of drugs returned during a period of 1 year in our pharmacy, and we saw that 47,139 euros were totally lost because they come of packages being packed in classes C and D boxes. This would be the equivalent to treating 78 individuals with a standard co-formulation of rilpivirine, tenofovir, emtricitabine during a month. We have classified all the current antiretroviral specialties depending on their social efficiency as supplied in Spain, United Kingdom, and USA. Use packaging shows a greater deal of Class C and D bottles compared to Europe. Unfortunately, newer drugs are being packed in classes C and D, so the hidden cost would be maintained. Any improvement by manufacturers of social efficiency of packages should minimize these hidden costs that at the moment are being paid by National Health Services. And we also will encourage to the regulatory authorities to bear in mind the idea of social efficiency at the moment of authorizing a new drug that mainly are manufactured in Europe.